Hello, my name is Dr. Kanav Kahol, and I'm so glad to be here virtually at this wonderful seminar that has been organized. And I think I want to begin with, first of all, thanking all the frontline health workers, all the frontline people who've been really providing the kind of support that most of us need. I'm a guy who's focused on innovation, and this is one of those rare events, I think, in humanity where innovation is being seen in almost everything we do. Almost everybody is innovating. So this is also dedicated to the innovative spirit that I think everybody is showing, whether it is in dealing with our kids who need new worksheets every day in terms of education or moving ahead. I want to talk to you a little bit about digital sanitation assurance systems and what do they actually mean. And we've been actually developing these before COVID came in, but I think COVID has really made people believe in the concept of sanitation, made people also know that essentially in public spaces, when it comes to health, we are only as strong as our weakest link. Let's take a look at this wonderful picture taken in one of the offices in India, and everybody is so close to each other. I don't think a picture like this can ever be taken again with the COVID and with the current situation. In order for all of us to be able to, express our affection, in order for all of us to feel safe working in a co-working environment, we will need new solutions. And one of those solutions that has been talked about, of course, is PPE, the personal protective equipment. It's been around for ages. The fact is, we should be wearing masks, we should be wearing gloves. The importance of hand washing is so well known to surgeons. People have manuals on how to do it. There is software that tracks it, but we never really thought that this is something that will be required at a large scale, and that's what we actually require. But the problem with PPE is actually that research has shown, and this is some research that actually came out of Australia itself also, that there's almost 87% non-compliance to wearing PPE, right? And let's not talk about just now, right? So today, everybody's aware they need to wear masks, everybody is aware that we need to do this, but tomorrow, when we start seeing that the number of deaths has dropped to zero, but not the contagion, will we have the same reaction to PPE? Will we still be looking at everybody wearing masks? Will we still looking at everybody wearing gloves? And the answer there is yes. We do need systems now to ensure that sanitation is actually assured, because again, we are only as good as our weakest link. If somebody enters our office and they haven't washed their hands, then it becomes a big deal, right? We might all be vulnerable to different kinds of problems. And unfortunately, something like this, disproportionately, essentially, targets people who are in the lower socioeconomic group. So in a country like India, where you might have a lot of people who are poor, who are working in your office as pantry boys or working in your office, bringing you your mail, suddenly we'll start doubting them. Hey, did you wash your hands? And this kind of sanitation stigma is going to be very bad for the society, and we need to get rid of it. And what better way to do it than to actually digitize sanitation? So how do we go about doing this? Well, at Pink Tech, we've been actually working on some very, very simple but very, very elegant solutions. So the first thing is we actually worked on a hand sanitation station that actually allows you to measure if your hands are sanitized. So when you sanitize your hands, the alcohol and the different gases that are being released, they can be actually sensed by an IoT sensor. And then using a neural network, we can actually look at the dissemination rate of those gases and be able to predict whether you washed your hands or whether you sanitized your hands correctly, or whether those hands are still requiring more of the sanitation process. And that's what this very simple station actually does. It's below $100, something that can be integrated in every biometric reader, so that next time you log into your office, you also have sanitized your hands, and the system will light a green light that says, hey, you've done your job, or a red light that says you haven't. We also have AI algorithms that can actually take CCTV cameras, webcams, feeds from those particular points, and actually go ahead and predict whether you're wearing gloves. We also able to do mask detection. This is all done through artificial intelligence. We have convolutional neural networks that can actually detect the presence of masks, and you can go ahead, and all of this actually can then go into an adherence database. So we will be able to say, all right, everybody in this office has been actually adhering to the given sanitation requirements. And then this can even go ahead and generate sanitation ratings, which would be very relevant, for example, for a restaurant, or a delivery boy, or a delivery personnel rather. And that's where this kind of technology of digital sanitation assurance system really becomes very, very handy for all of us to feel safe in a public environment, and for all of us to actually return to quote unquote the normal life that we are used to, which does involve affection, which does involve all of us caring about each other, and not again, using sanitation stigma. This is an example of how this particular system works. These are two kids, 7-year-old and 4-year-old. Full disclosure, they are my kids, so you have to tell me how pretty they are. And I'll have my 7-year-old teach my 3-year-old on how to use the sanitation station.
Good.
I'm teaching my sister how to use the machine. It's not the clean,
No.
it's the sanitizer. Now put it. Now it is clean.
So this very simple system, and yes, my kids are the prettiest, not yours. This very simple system is something that can essentially enable us to develop a method. Now there is a lot of math and science that goes behind it. There is a sensor, there is actually IoT stuff that uploads it onto the cloud, and there's also a neural network that we actually trained by having people wash their hands correctly, not having them do it incorrectly, and then develop essentially a predictive neural network model that can, given this gas emission, predict within around 2-3 seconds whether you washed your hands and they're sanitized or not. It also has ways for you to remind everybody that it's 4 hours now, it's again time for you to sanitize your hands, and so on and so forth. So again, a very simple system that makes it happen within that. And it's easy to understand, doesn't require, as I said, that's why I have a 4-year-old and a 7-year-old showing it to you, that a red or a green light across the world means exactly the same things. So we can actually go ahead and benefit from something like that. Another one is, of course, the glove detection system. The system uses AI to detect people wearing gloves. We have a combination of skin detection, we have a combination of color detection, as well as neural network that is actually driving this. It can work up to 10 meters away, and it can even just use a CCTV camera that's available, and it produces records, and it can be linked with biometrics again, and we can work with mobile phone apps, webcams, and generate complete records. And I'll just show you an example of that in this particular video. And what you can see, of course, the red part there is actually detecting skin, so it's actually saying hands detected, please wear the gloves. And it goes ahead and then tells the person to detect the gloves. The person will actually then go ahead and wear the gloves, and we'll actually have the system come in. Now why is this important? Because we do know that not just in hospitals, but even in hotels, even in restaurants, the need to wear gloves is going to become quite central, right? And we need to understand that viruses like this are very, very contagious, and we do need, for all of us and all our sakes, to actually have everybody adhere to these requirements. The next one, of course, is masks. We can also detect masks. Again, there's a neural network that actually does it, works pretty much like that. But what we've actually done is something really interesting. We've actually added ways in which you can't fool the system. So here you can see the mask detected. Here this particular subject is trying to cover his face with the hand, trying to fool the camera. But you can't do that because the system is intelligent enough to record it. And what's also very fascinating is this little system where we've actually allowed a risk-based assessment. See, if I don't wear a mask, there's a different level of risk. But if this doctor who's going ahead and giving an interview on COVID-19 on CBS, he doesn't wear a mask, that's high risk, which is why our system is actually able to detect that the person is not wearing a mask and moving it on. Here also you'll again see that this is quite a simple system. We can actually go ahead, and it was detected back there also that he's not wearing a mask, and move on. So again, the system can actually pick up when you're not. And again, the doctor shows up, and you'll again see the high risk tag on the bottom. Now, at a community level, for us to be able to do these kinds of algorithms, to actually have these kinds of things, is going to make a pretty big difference in how we actually plan the world after COVID 19. And let's also accept the fact that this was something that we should have been doing at some level, but we never really thought that this was so important, you know. We would just go about and it was okay. But things like COVID 19, things like the Spanish flu, one also has to remember that Spanish flu actually came 3 times. It wasn't something that just came in one wave. There were 3 particular waves of Spanish flu. COVID 19 is going to be like that, and I think the next decade is going to be as much about digital sanitation as anything. Okay, just a little bit more about the idea of actually taking technology to enable sanitation. And we've talked a little bit about the digital sanitation assurance system. I want to also talk about where our real first defense against COVID began, and that was hand washing. See, hand washing has been there for centuries. We know how important it is, but we were not doing it enough. In fact, when you look at the WHO process to go ahead and wash your hands, the guidelines are actually quite complex. There's around 12 steps. There's 20 seconds. We all know what to do, but we were not doing it earlier. And I'm afraid after this emergency phase of COVID is over, people may again forget how to do it. So we've actually also worked on a smart mirror. So this is a smart mirror that essentially has the ability to react to people. It has the ability to show you information. We were using it for something simple, things like allowing people to see their emails while they're shaving themselves in the morning, or for that matter, to do something more like advertisements. But when this COVID came by, we actually had a small feature in our smart mirrors, and that was actually to show you how to wash hands. And so we've actually really found that that's been something that we imagine would be of use. But in the COVID situation, that's actually come out even more. So let me just show you a small video that actually shows you how this entire system works. Animation that essentially reinforces the behavior, and it ensures that everybody washes their hands in the correct manner. In fact, every public space, office and mall should have something like this. And I'll maybe take a break here and let you know how this actually came by. There was a person who showed up in my office. This is just before the lockdown in Delhi, and he refused to take tea from my pantry boy. And I asked him why. He says, well, I don't know if this guy washes his hands or not. I don't know how clean they are. We took him to our restroom and we actually introduced the mirror to him. And at that stage, he was actually a lot more satisfied about the sanitation status of our office. And he did have tea, which is excellent. But it actually pointed to me how something like this can actually again lead to what I mentioned before, sanitation stigma. My pantry boy is a guy from a state called Bihar. He isn't rich. He's definitely in the lower socioeconomic status. He's been with us for 4 or 5 years. He's a darling. We all love talking to him, supporting him. But because of COVID, some people may start seeing him as a problem, and that was unacceptable too, right? And the mirror is something that ensures that everybody washes their hands correctly. Everybody is actually adhering to it. You can link it up to a biometrics, and that's what actually prevents the sanitation stigma from building up. This particular mirror is around $400, so not very expensive. And you would imagine that if you have this in every public restroom, in every mall, in every office, there's a lot more of you that might be satisfied and say, all right, at least everybody's getting to wash their hands. In fact, now we've had requests of saying, hey, just always play this, Don't even make it something that's controlled with a wave. Just let people always have that reinforcement. And in fact, in a scientific study that we actually did, we found out that the compliance when you just see a video and wash your hands was around 56%. But when you actually go ahead and see this on the mirror, the compliance jumps up to around 97.3%. So there's a spectacular jump that actually happens by technologies like this that reinforce the behavior. Guys in marketing know it's all about repetition, it's all about that. So let's try and develop technologies that again use very innovative, simple methods to go ahead and make people be aware of what this can do. And once, let's say, people have learned hand washing, then the same mirror can also be used for other kinds of things. In a women's restroom, if it's private enough, it could be used for breast cancer self examination, it could be used for testicular self cancer examination, it could be used to give out messages of public health. Heck, it could be also used for advertisement that would then go ahead and support or provide revenues for us to do what we really like. So there is ways for us to reimagine the world and really use this COVID-19 as a way to transform the world into being a much safer place. I've also got some more scientific validation from the DSAS itself. The hand sanitation station, we've actually gone ahead and measured it, and we found that it was around 94.5% accurate in actually predicting whether the hands have been correctly sanitized or not. This is a very, very high rate. We've actually increased that now by having more sensors. So instead of one sensor, we have five, and the rate is close to around 97%. Actually, the cost of the device still remains below $100, so that makes it really cool. Mass detection system with our neural network was around 98% accuracy. And what's most important is it was also working with very low resolution data. So even if we had video in 320 by 240, we were actually able to detect the masks, as well as the glove detection system. The glove detection system we actually are tending to improve. It works with a variety of colors. Sometimes it gets confused, but 96.7% again is a very, very high accuracy. And imagine if you actually have, for example, an isolation ward, and you want to make sure that nobody enters it without gloves, masks, and sanitizing their hands. Lo and behold, we actually have a system that can actually do that. And the last part of this study that was very important was when we did this around 5 offices, 98% of users felt their environment was safer and more trustworthy, right? Because of these digital sanitation assurance systems. And again, I urge everyone to imagine the world after COVID. We've gone ahead and survived the first wave. Do you really think we'll be able to return back to a restaurant where nobody's wearing masks or not nobody's wearing gloves? These kinds of things will now change, and we will have to do this because this is actually the reality. Why that is the case, why that's not the case, is not up for debate right now. But clearly, preventing this from happening again is something that we need to do. We've also gone ahead and actually got a bunch of certifications around this particular system also. One of the things I really do like about innovation is the fact that we all get to try out our cool ideas, but it's very important to also realize that they have to work in the real world, right? And we need to have the same quality standards that we've gone ahead and do this. So we have gone ahead and self-certified this. Knowingly, of course, we have months of work beforehand that has allowed us to get these certifications within that. Again, the advantages are many. You've got to protect the community. Remember, one person not washing hands is good enough for the entire community now to be sick. So we can't allow that. We do need the community to be protected. You can go ahead and objectively schedule access. I love this word objective. I'm a scientist. So objective, anything is great. Emotional, anything is bad. I think we can divide our office, public space into areas with different sanitation requirements. And we can say, here's where you have to have, in this area, you need to have masks on. And guess what? I've got an objective way to say that you are wearing masks on. It's not going to be based on the whims and fancies of one single individual. You can conduct sanitation audits. I do think that this is going to be the future. We are going to require sanitation audits for every restaurant that shows up on whatever the restaurant aggregator app is there in your country. In our places, we have places like Zomato, and Zomato today I was ordering something food on, and they actually now have confirmation that people who are delivering my food have been washing their hands for the last 4 hours, and have been following the WHO things, and they've been certified in terms of a training that they organize. So this is important. Everything with like this has to be reliable and affordable. We need to take it to the big scale. I am looking for partners who can help us scale this up, and that's going to be an exciting an exciting journey for some of these technologies to actually come by. We're also developing other technology. So again, using the camera that's available with CCTVs, we are developing an AI-based social distancing filter. It's actually working. We're just testing the whole thing out in terms of its accuracy. But again, you can see that the system will actually put, for example, a blue square around a person in case they are following social distancing, and a red one against people who are not following social distancing. Again, meant to be something that informs people, informs authorities if they do need to take some kind of action within that. My takeaway messages. So one is, I do want to talk about, one of the great challenges of I think the current time is primary health has always been ignored. The world likes big sexy hospitals, and those are very, very important, and primary health has been ignored by the world and all. We need to now actually take the already ignored primary health and actually include sanitation into it. Historically, public health departments, at least in India, were under the civil engineering. They were not even considered to be something that are under healthcare. We need to transform this, and sanitation, how we follow sanitation, how we actually talk to communities. It's going to require for primary health to include sanitation and objective methods of doing that. We need to prevent sanitation stigma. I can't state this enough. We've had cases in US of people going ahead and stopping folks of Chinese origin and say, hey, you caused this. They didn't, right? And sanitation stigma is going to be a thing that will have a variety of facets, and I think we need to address it. And finally, I think using technologies like the mirror, we need to reinforce behavior and actually enable technology based behavior change. One of the great wins of this particular community, the digital health community, has been how people have smoothly adapted to telemedicine. My wife burnt her hand just yesterday, and we were on a telemedicine for 49 rupees, which is ridiculous amount, probably less than $1 Australian. And we got a doctor to come in and advise her what to do. It was brilliant, and I think we need to now really make things like this happen through technology. And wins like the telemedicine are only an enabler for what the next phase of the digital health movement is going to be like, and it's going to be very, very exciting. Again, a big thank you and a virtual hug to all that are protecting us. I am in awe of what people are doing. I'm in awe of their families, and I'm in awe of this particular group of people that I'm talking to also. Louis Shaper, everybody who's been involved with this society. You guys are doing a tremendous job in keeping all of us informed, and information is going to be one of the big things in fighting this particular disease and what lies ahead. I look forward to the interactions in Q&A.